actually go through and mark off the clubs that have actually submitted content already. So some of your clubs have already done this. You guys have already qualified for mission 2. As I said earlier, what I'm going to do is I'll have a scoreboard up this next week. You'll see that whether you have completed that mission, all of the missions. And then for mission 3, what we're asking you to do is to create a people of action photo. If you go to the district website and you go to the PR tab, there is a link for the superhero challenge, and there's links there to actually take you to the either the people of action photo filter or the Rotary Brand Center, so you can create your photo. On January 29th, that's when all of these need to be completed by, and on January 30th, when we have our town hall, we will do a we'll hold a, I want to call it a raffle, it's not a raffle. We're going to do a drawing online with all the clubs who have completed them. And then we'll pick 3 clubs who have submitted. So
absolutely. So that's 3 clubs that will have the chance of winning $500 each. And this is just the first round of prizes. This is just a way to not only get clubs engaged, but also get them up to speed with the look and feel, especially in public image. And then we'll go on to some additional missions along the way. And the prizes, they might just get bigger. And so with the money, you can do anything with the money. You put it in your operations for your club or give back to through a service project in your local community. So I think it's an awesome deal. Thank you, Pam, so much. And Pam talked about January 30th being our next town hall. What's special about January 30th? And that's a Saturday, by the way. Well, Rotary International President Hoger Knack is going to join us, and I'm super excited about that. And so we were able to get him booked, and we're going to start promoting that, of course, January 2nd, so we can get as many folks online. Feel free to invite your fellow Rotarians and also friends and family. I think he has a great message that he wants to share with us all. So join us January 30th, and we're going to do the drawing during that day. Okay. Next up, so the next announcement that I have, so recently myself, Jane Burton, and some other great folks, we interview a great candidate for our global scholarships. And I'm so excited to announce that the young lady's name is Montana, and she has won, she has been awarded $30,000 to go to the school of her choice, and she is going to be a great ambassador for Rotary. Let me tell you, I wish we could have recorded that interview, because she is dynamic, and she just sent over some great pictures, and so we're going to upload and highlight her and also support her along the way. But that's
Can you tell us something about her?
Absolutely. So Montana, let me just bring up what school she's going to. She's going to let me pull it up. It's in Taiwan. You see, her name is Montana Meeker. It's so much to say about her. I mean, it's hard to kind of sum it up. She's already been in contact with a few folks with a Rotary Club in Taipei. She's going to focus on water and sanitation. Her background, she's worked with local municipal governments to understand how sanitation areas are functioning, how to improve that aspect here in the United States, but also abroad. And so she's just going to go out, work with the local community and help advance water and sanitation in that area. So I'll post some more on my Facebook and some other areas, but she's the one. She's the one that we want, and she's going to do outstanding things. And she's interested in joining Rotary at some point in the future. And I think she'll make a great Rotarian.
Where does she go to school now, and where does she live?
She went to, let me bring it up. John is asking all the hard questions, John. See, I tried to come prepared with everything. Here we go. Here we go. Let me bring this up here. All right. So Montana, she went to University of Texas at San Antonio. She had all A's, well, here. And I'm trying to get the name of the school that she's going to go to. It is National Tsingshan University, NCCU, is where she's going in Taipei, Taiwan. And her interesting background is she had an International Master of Arts in Asia Pacific Studies. Now, how does arts translate into water and sanitation? Well, I believe that creativity is the underling of a lot of great successes. And because of her work that she's already done outside of her degree, it translates greatly into the work that she's going to do in this particular area. So, did I answer all your questions, John?
Yes, sir.
No more, because it's hot in this hat and you're making it hot. So,
well, if you'll observe my hair, there is a slight solution to that, sir. You might adapt.
Well, you know what? It's coming soon because, man, look, I got this hat on partly because I'm in the spirit, but the other side is I can't get to the barber. As you can see, Eddie knows what it is. All right. So, well, again,
I can tell you the barber could come to you and it's real simple.
Well, again, thank you all for joining. We're going to get started because we have our guest speaker, who is Dr. Jim Partin. I'll read a little bit about him. Like I said, he is a part of the Fredericksburg Morning Rotary Club. They are the hugging club, from what I hear. I know we can't wait to do that again. But he's an accomplished medical director, an internal medicine practitioner with both clinical and hospital management experience. He's implemented successful clinical and regulatory programs. He's leveraged data and clinical knowledge in a fast-paced setting. He has a strong record of oversight and care navigation. And from what I hear, he is very intertwined into what's happening in our current day with COVID. And he's an advocate for us staying safe. And he knows just what to say. And so he's also the Chief Medical Officer of Hill Country Memorial. And so without further ado, Jim, thank you for joining us, and feel free to unmute and just tell us a little bit about where we are with this COVID thing. Tell us a little bit about COVID and navigate us to where we are and where you think we're going, especially with the vaccinations.
So first of all, let's look at what's happening with COVID in the Hill Country as well as the Central Texas region. Basically, the numbers are rapidly exploding. Most places are at least 300% increase in their active cases in the last 4 weeks compared to where they were back in October. We alone here in the Hill Country have over 150 active cases. We were 8 or 10 or 15 6 weeks ago. And so what we're seeing both locally here where I am, as well as across the state, and definitely in a region of the metropolitan area of Bexar County and the regions around it, is actually the very early part of the surge from Thanksgiving. We have not at all seen the peak of that. Hospitals are about to be overrun. I can tell you our hospital has 10 ICU beds. There are 10 people in those ICU beds right now, 2 of which are on ventilators from COVID. We have one nursing home, for example, here that has 38 residents and 34 are infected with COVID. And so the numbers are actually rapidly expanding, and we now need to be more careful than any time in this pandemic. We are far worse than we were back in July. And I can tell you that our biggest concern here in my region is how will the bigger, larger centers be able to support us when we have patients that are really ill beyond the capabilities of us being able to care for them in the smaller rural hospitals. And so our numbers are expected to increase again. We looked at a model today with the intensivists in the San Antonio region. That model has us continuing to probably double our numbers again in the next 2 to 3 weeks. And so it is far more an issue now than it ever has been. And so the treatment is the prevention is very simple, and it always has been. It is basically good public hygiene, public health hygiene. And that means wearing masks, Self-distancing, 6 feet or more if possible. Staying at home when you don't need to be out. Avoid crowds. Avoid being around people that are ill. And if you are ill, stay home. Stay home and contact your physician. Don't go to your doctor's office. Don't go to the emergency room. Contact your doctor for advice, because many times there'll be something you can treat at your home. And so we need to do this more stringently than we've ever done this in this pandemic to date. We have some new treatment protocols that are helpful for the people that do get ill. We are actually seeing more and more utilization of the monoclonal antibodies. In fact, there are, in the larger cities, their infusion centers are being set up separate from the hospitals, where the people that are mild and moderately ill and are outpatient and not severe enough to be in a hospital and not on oxygen can get the monoclonal antibody to help prevent them from getting any worse, and hopefully keep them out of their provider's office, but more importantly, keep them out of the hospital. There's also some new treatment medicines added to our mainstay, which is remdesivir. We've been using for some time dexamethasone, which is a steroid anti-inflammatory with it. There's now a study comparing dexamethasone with a arthritic drug treatment. I'm blocking right now the name, that to see if it's more effective than the steroid at preventing the what's called cytokine storm, or the overwhelming inflammatory response that occurs with COVID. But this still basically the treatment is supportive, keeping people oxygenated, keeping people comfortable, intubated on ventilators if we need to, and the mainstay is try to keep yourself from getting infected. As far as vaccines, that is really something that we now can sink our teeth into. Pfizer has been delivering vaccines beginning actually on Monday. Several facilities in the San Antonio region are already vaccinating patients, and vaccinating employees and people at high risk. And then more are starting their vaccine program next week. The Pfizer vaccine went to large institutions and a major city. The reason being is twofold. One, it comes in the smallest allotment of 975 doses, bottles, and there's at least 10 and many times 7 doses in each vial. So you have to have a large number of people that need the vaccine to be able to utilize those vaccines and not let them go to waste. And also you have to have a storage facility that can keep them at the minus 80 degrees centigrade. In most rural areas, in particular no one here in Fredericksburg has capability of doing that. And so that leaves us with using then the Moderna vaccine, which looks like will be probably given an emergency use authorization by tomorrow, and expect then shipments to start as of the first of the week. And those allotments are smaller, there's 100 each, and can be stored in the regular refrigerator freezers that the hospitals have readily available. But the vaccine is going to be very limited as far as the number. And the people that will be getting the vaccine first are going to be people that are frontline healthcare workers, that meaning ER nurses, physicians, personnel, housekeepers that really clean the rooms in the ER, those also in the ICU and the COVID units, as well as the EMS and fire, as well as the nursing homes and the nursing home people that go. For example, our home health department has a lot of visitation into nursing homes, and so they'll be vaccinated. So the high priority people will get them first, and we'll go into the next level probably sometime within a couple to 3 weeks. But as far as most of the people on this call, except for the number of us that are actually in the age group that puts us at high risk, most people will not be able to get the vaccine truly until probably March or April. And my understanding from what I've been told, it really will be probably closer to May or June before everybody that wants a vaccine can get the vaccine. The vaccine is in 2 doses, and what is happening is that When we get 100 vials, 100 doses, let's say, 50 of those go to a patient and 50 goes in reserve for the repeat vaccine in 21 to 28 days. And the side effects are there. And so we are encouraging people that, for example, a unit in the hospital of nurses to stagger the vaccines, because there's going to be about 15 to as high as 20% of people will get sufficient enough side effects to not be able to go to work for 1 or 2 days. But by far, the people who've had those reactions would say in a heartbeat they would take it all over again to protect themselves. And there have been very, very few significant issues. There were a couple of anaphylactic reactions in England. Those 2 patients had a significant history of anaphylaxis for other things, and those are the ones that will be contraindicated for getting the vaccine. But generally, the complications are very, very minimal. And so that's kind of a quick 30,000-foot overview, and I really would like to more specifically answer questions that anyone might have.
Yeah, there's a quick question, and thank you so much for sharing that overview. There's a wealth of information. There is a question that says, Doctor, is there any discussion of in-home infusion of monoclonal antibodies rather than in separate infusion centers? Do you know anything about that?
Yes, and the reason that's not the case is that we have to be prepared to treat an anaphylactic reaction when we utilize the monoclonal antibody. So it's only been released to hospitals, actually, and hospitals have set up centers away from the hospital, but at those centers, they have the capability with crash carts and epinephrine and et cetera to be able to treat anaphylaxis that occurs. So it likely will not be in a home area because of that very thing. So the answer to that question is it's going to have to be released in a hospital regulated facility or an outpatient facility that is actually backed by the hospital to treat those complications that occur.
Oh, great deal. So Doc, so we hear, a lot of things, of course, on the news and different things on your feed. I've been trying to block most of it out. But there's so much, and as a Rotarians, we know the effectiveness of vaccines and what they've been able to do around the world. Should there be any concern by way of anti-vaxxers and things of that nature, perhaps even with the vaccine being different than most, where they talk about it being an mRNA and biotech versus some other vaccines that we've had? What do you have to say about the difference in anti-vaxxers and things like that?
Well, there's actually a great 30-minute interview, and I'll actually send it to John. You can pass it on, you can send it to the district. I mean, it really is worth viewing that 30-minute interview between the CDC leaders that have really looked in detail at the safety and the effectiveness of this vaccine. I think once people have reviewed that 30-minute video, I think they'll be much more comfortable at taking the vaccine. We have anti-vaxxers here in my hospital that won't even take a flu shot. And so it is a pervasive mindset that's different than the people like John and I who grew up having to be frightened to death of things like polio and measles and smallpox. Nowadays, people have not seen those. I think anyone who has actually grown up and seen what these devastating infectious diseases can do are much more prone to get the vaccine. And right now, we've got 300,000 people that are dead and scores and scores that will be actually ill for a long time. Look, this young basketball player that just kind of killed over 3 months after having COVID, and very likely was a cardiac issue because COVID causes significant cardiac rhythm issues and cardiovascular type complications. And so it is a disease that we should fear, and we have access to a effective prevention, and we should actually utilize it. So, I'll get John to send that out so you can get that disseminated amongst the district. See if we can get people more knowledgeable, make it a knowledgeable decision, not an uninformed decision.
Absolutely.
And something that happened very fast. I mean, we have a messenger RNA vaccine that we've never even heard of, 12 months ago. It's been actually on the shelf and people have been studying it, but never had the opportunity to utilize it. So it's new, but I think it's been well studied and safe for us to go with it.
Thank you. Thank you so much. I think that falls on good ground for a lot of folks that may have been on the edge a little bit. There's a question over here. They're saying, how will we know when the vaccine is available to us if we're not high risk? Would it come through our doctor, a local hospital? How will we get information for us, common folks?
And so it's going to take a great deal of actually communication. We here locally in Fredericksburg, we have been meeting once a week with all the different entities that are to get vaccine, and we'll put out in various different forms, newspaper, probably radio, websites, including the city's website, social media, because right now we can simply say the first people to get them are this category. And this category is going to be healthcare workers, basically. And then those are high risk in nursing homes. And Davies on the call informed me today something I did not know, that CVS actually through a federal grant is contracted to take care of most, if not all, of the nursing home residents in our region, and I assume the state. That also includes the Walgreens as well.
Thank you so much. There's a question in there.
It's going to take communication.
What's that, doctor?
It's going to take communication. Mm-hmm.
Absolutely, absolutely. There was a question in there saying, how can our clubs help out locally with vaccine distribution, and are hospitals the best contact for this information on each? And I'll just share something that came from RI President Ho Burnett here recently to our district, and he was talking about where Rotarians fall and them getting asked questions, how can we get involved with the COVID vaccination? And the answer is yes. And of course, we will have an important role in the months ahead. He said he wanted me to send some encouragement to say, utilize Rotary's knowledge of vaccines safety and efficacy based on our polio eradication experience to conduct vaccination education and communication. Doc, we just talked about that in our local communities. This will need to be tailored to local context to address unique cultural and regional needs. Your leadership will be critical in crafting the appropriate messages and strategies. 2, engage where appropriate with the current polio eradication partners, the World Health Organization and UNICEF at the country level to offer Rotary's support to COVID-19 response activities, including vaccination efforts. And 3rd, partner at the local level with governments, corporations, foundations to support Rotary's activities at the country level. And so that's falling right in line with what you said, Dr. Partin. That answers your question, Amy. I think we get in and we work with those organizations who are seeking our assistance and help, reaching out to them and figuring out how we can do things safely to support the efforts, because I think our help is going to be needed here soon.
Xavier, may I ask a question to Dr. Partin? Tom Hutton here, Jim. In the event that rural hospitals, and several people here are from smaller communities, as you know, in the event that the smaller hospitals are overwhelmed by COVID, what's the likelihood that we can transfer patients into the urban centers in Austin or San Antonio, wherever? Have you had to do that yet?
Likelihood, John, that likelihood is almost drying up. The New York Times has a great interactive map. And I think the title of the article that map was actually embedded in was how the hospitals close or around you doing as far as admissions. And so you look at, for example, our biggest referral area is the metropolitan region in San Antonio, Baptist, Methodist, university, et cetera. And you look at those and they've got 8 or 10 available ICU beds per institution. And so the numbers are really beginning to be very, very saturated with COVID patients, and it's getting harder and harder. I can tell you what we're having to do, and luckily we partnered up with a group called Access Physicians in March of 2019, which are critical care pulmonary specialists, but that has supported us with telemedicine. And so we at the bedside truly have intensivists that can actually manage ventilators and the sickest of the sick patients. So it's helped us to take care of the people that we cannot transfer. There will be somewhere down the line, I'm fearful, Tom, that we'll have to make some hard decisions. You know, this person may get treatment, this person may get palliative care. And I can tell you, when we got a situation, I think I mentioned that earlier this evening, is that this is just one of our nursing homes. I don't know about the rest of them, but one nursing home that has 38 residents have 34 of them infected with COVID. And so and most of those are elderly. When it comes to, you know, we have to choose about, you know, a 55-year-old being on a ventilator or a 95-year-old with Alzheimer's disease being on a ventilator. We're gonna have to make some really difficult decisions, and no one wants to do that, but it may be forced to. So we're getting to be now what we've seen on TV with El Paso.
Yeah.
El Paso just got hammered, and we're starting to slowly get to that area here. We still can transfer people out right now, but I'm concerned about what's going to happen, particularly after the Christmas surge into mid-January and the end of January, as to how it's going to be affecting us as far as our ability to transfer patients out. It's not just COVID patients. The other thing too, we've got people that are severely ill with bad heart disease and congestive failure and other types of pneumonia and trauma. I mean, all those have to find a bed too. So it all impacts that.
Well, that's really an agonizing decision that potentially will face you. May I ask you a somewhat broader, a philosophical sort of question? As you know, some of the countries around the world have done a much better job suppressing it than we have been able to do in the United States. And a lot of that seems to have been related to contact tracing. And we've been apparently quite unsuccessful in the United States in even launching effective contact tracing. I know, Jim, you've had some personal experience trying to get that going in the Hill Country. Why do you think contact tracing is so difficult, since that has the potential to suppress the virus?
Well, Tom, the countries have done an extremely good job of it, really have a different mindset in their involvement of the individual to the state. I'm talking about, South Korea and, other areas where they truly do have the mindset of giving up personal freedoms to be able to do this, some of which are actually contact traced on their phone. They have an app on their phone that when they know they've been infected, their phone will tell them who they've actually been in contact with for what period of time, going back 2 weeks, because people are giving up their freedom to be able to allow that personal invasion of their privacy, I would say. And the other thing too, we've had people that will just not even answer the phone. We go to do contact tracing and they won't answer the phone. We ask them a question, they hang up. And so it's a different mindset in the United States as to how we deal with personal freedom versus the collective health of the community. And it's not going to be changing anytime soon.
Thank you.
And thank you, Tom, for those great questions. Dr. Partin, there was a question about, can you get the vaccine if you've already had COVID?
Yes, you should, and it's recommended that you do. As far as we know, we are protected from having a repeat COVID infection for at least 3 months with having had COVID, maybe longer, but that's all we know right now. the 3 months. And so the recommendation is that irregardless of whether you've had COVID, when your time is up in your group, let's say you're an ICU nurse, you had COVID 2 months ago, you should by all means get the vaccine. We're not asking anyone to not get it based on their previous infection.
Thank you. You know, I'll tell you, since this thing started picking up back in June, well, of course, we've been sheltered in place since March, to be honest. But when it really started to pick up some steam, my biggest concern was, you know, Rotarians and how we fellowship together and the important aspect of coming together. And it was a hard decision to really put out there to say, hey, we shouldn't be meeting in person. And, you know, of course, along the way, there are some clubs that feel like they're more safe than others and that they can bypass somehow the disease. And we now know that that's just not the fact. In fact, I'm also getting, you know, some calls that folks are getting COVID. They're ending up with double pneumonia. And so it's breaking my heart a little bit, I'll be honest with you. Would you suggest or say that we probably shouldn't meet in person? And here's what I'll say, you know, clubs can do what they feel is best for their body, their membership. But as far as my guidance, I don't think we should be meeting anytime soon in the future, unless it's a social distance outside type of service project of that nature. What are your thoughts on that?
I absolutely agree with that, and particularly now more than ever. And I would not say that we could be safely back in our clubs again, probably until middle or end of Q2 in 2021. We have a kind of a personal rule at the hospital. We have no meetings that in person that has more than 5 people. And those rooms are quite large, are meant to, you know, to have 30 to 40 people in the rooms. But we can social distance in that situation. But almost every meeting that we have now of our medical staff, our board, our administrative staff, et cetera, are all meeting virtually. And I would want to encourage continuing that until way into, you know, the spring.
Sounds good. And
you know, if they do, a question was asked on that question was asked, okay, I got my vaccine, do I keep wearing my mask? And the answer to that is yes. And so once we get a vaccine, changes nothing in the short term as far as social distancing, wearing masks and so forth. That is not going to change. So don't think that I get my vaccine, mask comes off and I'm done. We're not. For a couple of reasons. One, there's still a 5% chance that you can get the infection. And thank goodness it's a mild infection when you get it. But that would be a possible way that you might transmit the virus to someone else. And what we also don't know for sure is the people that can't remain asymptomatic, are they possibly also getting enough of the virus that actually they would be able to transmit it, although they're not getting ill. And so all the stuff we're doing now, hand washing, social distancing, wearing masks, is going to be the same 2 months from now that it is right now.
Oh, wow. So my next question for you, and feel free to put any more questions into the chat box. But my question for you is so we know the flu virus mutates, and there's different strands. Has COVID mutated and developed different strands, or are we just with one strand now, or what's going on in that area?
Well, just think of actually the likelihood that a mutation would occur. And so basically what a mutation is a mistake in copying the DNA from the prior DNA that you actually are copying. And so when there are billions, trillions, no telling what the real number is, of copies made every day, there are going to be mistakes. And that mistake is a mutation. There is already a suspected mutation that happened in Europe, and it appears to be that mutation caused the COVID virus to be a little more lethal, a little more dangerous. The real question is, are we still protected with the vaccine? The vaccine is aimed at the spike protein, and so far that appears to be relatively stable in that particular part of the virus. And so the vaccines at this point appear to be effective, but we'll be surveilling this thing, and I would not at all be surprised that every fall we're getting a booster, just like get a flu shot because of the potential change in the virus.
Someone in the chat said, I got sick starting Tuesday, cough followed by sinus headache and fever. He's on a course. He's a course of antibiotics, but then also got tested for COVID today. If positive, is he able to get infused at HCM, which is where you?
I guess we're talking about then of the antibody treatment, and we have HCM only for given 5 doses of the monoclonal antibody, and it'll be, of course, a case-by-case basis. And as long as the symptoms are mild and moderate, and there is no requirement for oxygen treatment, and definitely no requirement for hospitalization, that is the people that are candidates for the monoclonal antibody. And so it'll be something we would discuss with your physician. And if the physician agrees that you would be a candidate, then we are giving it at HCM only in the emergency department. And the reason being, number one, we have such a limited number. We don't have the need to set up an infusion clinic. But number two, they have the facilities there to treat any kind of possible complication that occurs. So if by chance your test does come back positive, you want to get treated earlier if possible, definitely before the 10th day. So I'll be contact your doc as soon as you know about the test and get their advice as to what you should do.
Thank you. I don't know if this is a follow-up question to the last question, but the person asked, he said, what if you live with a person that is high risk, who is not in a retirement home, but is still very susceptible? Maybe had recent cancer treatment, surgery, anemia, 75 plus. And feel free to unmute and ask that question maybe in a different way. But Doc, can you answer that, or you need some follow-up?
So I guess where are they in the scheme of things as far as the likelihood of getting the vaccine early? And the answer to that is, at this point, probably that will be in tier 2 of people that are in that age group. I can tell you personally here, my mother-in-law is living with us with Barnett, Ohio. She's 95 and she's got COPD. She's got congestive heart failure. I mean, she's extremely high risk. And so I suspicion that she will be able to get a vaccine within the next 21 to 28 days.
Great deal. Someone asked.
I'm sorry, one more thing. And those vaccines may be then available by that point in that age group with some of the retail pharmacies.
Oh, great. Wow. Someone asked, what are your thoughts on the Abbott or other in-home COVID testing capability?
What those really are actually to test if you have symptoms. Someone utilizing that particular test that is totally asymptomatic, just to see if they might have it, the accuracy of that is actually quite low. But for someone who has symptoms and a test accuracy of a negative test is about 95% accurate. And so it's to be utilized for someone that really has some symptoms. Right now, it's not a test that you get up every morning and test and see how you are before you go to work. It's not really very effective in that way. Hopefully, in time, we'll have something that is that effective, but we're not there just yet.
Thank you. So, Doc, I'm African-American male. I know in the minority community, there's a lot of distrust. And again, that kind of circles back on education and really understanding. And I'll tell you, even though there's information flowing. There's a certain level of distrust when it comes to vaccines. And you hear a lot of people these days saying, hey, I'm gonna wait till everyone else gets it, and I'm gonna see how everything shapes up. And I'll be honest, I went to the doctor the other day, well, actually telehealth, and I was speaking to the nurse, and she said, hey, I'm gonna wait and see. There's really no wait and see, right? Because if anything's gonna happen, it may not happen immediately or at all, but you're not going to see any immediate changes. Is that correct, or what would you say?
Well, yes and no. We discussed this at the Rotary Club, I think this morning or somewhere today. In my history in medicine, and Dr. Hutton will maybe help me remember what the drug is. But an example, we had an anti-inflammatory drug probably released in the early 80s. I want to think that name started with a Z, and it was touted to be the best anti-inflammatory available, extremely safe, and had been tested in their phase 3 trials of 30, 40,000 people. And then, of course, lo and behold, that drug started being pushed by the drug companies and drug detail people coming to your office and giving free samples away, et cetera. Then all of a sudden you had millions of people taking the drug. Well, we started having people having some major side effects that we didn't know that actually existed. In fact, Tom, you may remember there was a cardiologist, I think it was, that actually arrested in his backyard with this drug. And luckily his next door neighbor was an anesthesiologist, resuscitated him.
He was pretty lucky.
That's about that time that drug got taken off. So the long answer to your question is that we may find out some side effects that we don't know now as we start giving this drug to millions of people. But it's a wait and see thing. And of course, if it actually shows up to be something to be concerned about, it'll be actually publicized. What I understand is actually that Pfizer is doing is that when you go take the vaccine, you're given an app. The app actually prompts you to give daily reports of your side effects over time. And so that will gather a lot of data very, very rapidly. So should we wait? I'll tell you, I'm not going to wait. I've seen enough evidence that it's effective and safe. And I'm not going to wait 2 months to see how everybody else does, and then I'll take the vaccine. But some people have that mindset, and I think that they're wrong, but so be it.
Well, I'm leaning definitely towards getting it. Judy, she put a note in there, and I agree. She said, well, if everyone waits to see what happens, then no one will take the vaccine. There will be no one.
Right.
Real.
And for this virus to actually kind of really begin to go away to the point that we can get back to what was normal for all of us, it's going to take at least 65 to maybe 75% of the population being vaccinated.
Mm-hmm.
That's when we'll have herd immunity. Until that time, we will have to continue to do all the mask wearing, social distancing, and we will not be back to where we want to be like it was before the pandemic hit.
Yeah, I agree.
Xavier, could I ask a question about a potential service project related to this?
Absolutely. Yes, sir.
Jim, you're aware of a project that's going on to benefit Hill Country Memorial first line workers, in which after their long shifts, and I understand they're working sometimes 10, 12-hour shifts, when they finish, they're presented with a meal for themselves, a really nice meal for themselves and their family to take home. And I know our Rotary Club's been involved with this. And I'm curious and concerned about morale of our first line people. Is this effective? Is it useful? And do you think this has the potential for other clubs to pick up and provide this service for our healthcare workers?
It absolutely is effective. And I tell you another thing that has been a major effectiveness here at the hospital is actually those nighttime prayer vigils that occur in our parking lot. People come in and they turn the lights on in their vehicle and line up the parking lot and they're there for, 15, 30 minutes, and they're there specifically, and they have put signs on their windshield and so forth, and to say we're here to pray for you. And it's a major shot in the arm for the staff.
Absolutely. That's amazing. Yeah.
And I'm telling you that they're pushed thin, because our staff right now, we've got 10 or 15% of our staff is actually homesick with COVID.
Wow.
And not only does that leave the people behind them to work harder, it puts them at concern. Am I going to be the next one to go down?
Mhm.
And so something that they are really dealing with a significant level of emotional stress day in and day out.
Wow. Wow.
Jim, Joe Kavanaugh. I'm the one who asked the question earlier about being infused here. How you doing? I want to ask a question about the rollout. You talked about the doses we get. You're reserving half of them for the second shot. I've been wondering
Right.
how that was going to work, because why don't we use them all and anticipate getting the next batch to give the second shot when so we can get twice as many people started earlier. That makes sense?
Well, yeah, and it is imperative that we give the second vaccine within a timely fashion. 21 days for Pfizer, I think it's 28 days for Moderna. In a
Yes.
few days on how that we can actually go. We cannot depend on the next dose again to be able to fill that role. And so what we'll be doing is that everyone that gets the vaccine will be given an appointment card of when to come back for the next vaccine. And some of these, I think, also have a good app that you can download as a reminder. And so we just can't depend on the pipeline of when the next dose is going to be.
That makes
That's
sense.
the reason.
Thank you. Thank you. Thanks, Joe, for that great question. Hey, got a question in the chat box. One of the last questions that we're going to ask here. Do you have, how are you doing with PPE for your hospital system?
We actually were very proactive when things quieted down in mid-October to just stockpile PPEs. Right now, we actually have a good supply, and we're actually able to get it better than we were back in July when things got so tight. And so right now we're okay, but we're utilizing a ton of it. I mean, everybody we see basically in the emergency room has to be treated as a COVID suspect before we know otherwise. And so we utilize a lot of PPE in our ER. At least upstairs, we kind of know who's got COVID and who hasn't, because our testing coming through the ER. But we're okay right now, and we have set up ways to actually re-sterilize a lot of our equipment. Our N95 mask, can be actually re-sterilized up to several times. And so we can utilize those things if we need to. Right now, we have not had to do that, but we've got that on the drawing board and equipment to do it with when we need to. So we're okay.
Great deal. Well, Dr. Partin, I know you've had a long day. You've been working, and I just want to say thank you for all the great work that you're doing and your team, especially up in Hill Country Memorial, and just being an outstanding healthcare professional. Our thanks we can't express that enough. Thank you so much for filling in this evening and presenting and letting us know what's going on in the world of COVID, especially during our month of disease prevention and treatment. I think we've learned a lot this evening in the work that is being done and what we can do as Rotarians. And I think if I gather correctly, that's stay out the way until we can synergize our efforts with local hospital systems, local governments, et cetera, meet virtually when and if possible every time we can, just to stay safe and take the vaccine, because it's our best chance at seeing tomorrow and helping us get to herd immunity. So again, thank you so much for spending time this evening, fellow Rotarian, and I mean, what can I say? This has been one of those years, and I'll just leave with this. I want everyone to just take a moment of reflection and just think about something you are grateful for this year as we get ready to sign off. I think we need that moment of reflection. And as we chart into a new year, we will go with that as a gift. So we'll just take maybe 10 seconds just to reflect on something positive this year. And with that, I'll say I am thankful for each of you, and together we help the world spin. Merry Christmas and Happy New Year, and we will see you all next year. Stay safe.
Merry Christmas and Happy New Year.
Merry Christmas, everybody.
Merry Christmas.
Merry Christmas.
See you all.
Stay safe.
Indeed.
See you soon. Okay.